I have a couple of questions. Dr. Sago, there had been many criticisms regarding the Lumetra control, the report that you did. And it's my understanding that the criticisms is that you didn't have a sufficient amount of information. But it's also my understanding that there was hospitals that were hesitant about giving you information that you sought, even though legislatively you were protected. So can you care to delineate that?
Because our study was used multiple methods, we are confident that it is representative of the state of California. We used random selection, a stratified random selection, to make sure that we covered all the various groups, hospitals, health plans, so forth, but also different types, so urban, rural, various regions of California, and teaching, non-teaching, systems, non-systems, to make sure that we were getting a representative sample. So we're very confident that this is representative. Of the groups, the hospitals, there was a great amount of anxiety about providing in some hospitals, any documentation at all. But they particularly were reluctant to provide minutes of peer review meetings. They cited Evidence Code 1157 as the reason for not having to do that, and on advice of their attorneys, that many of them did not send us minutes.
Dr. Lowe, I have a question for you. What is the timeline that you think the average, and I know it's going to vary in different cases, that a peer review should take? What do you feel that it should be?
You mean within an institution? Or
with an institution or with a board or whatever?
Well, it's going to take probably months. And the reason it takes months is because of the different people that you have to get to review the records. You need to get true expertise, and you need to do a thorough review, and going through medical records is a very time-consuming affair. And most of the people in institutions doing peer review have a regular full-time job. That's not their full-time job. So it's usually done after hours, it's on a voluntary basis, and it takes a lot of time. The medical board, at the same time, tries to be as efficient as possible in the process of getting it to our reviewer. But again, the reviewers take a certain amount of time, and again, they have work as well, and this is generally done after hours. And so it will take us 2 to 4 weeks to get a report from an expert reviewer. So I think maybe sometime in the 3 to 6 month range is not unreasonable.
So let me ask you this then. If there was a physician and he was causing harm to the public, and it took X number of months, does that doctor still have the ability to cause the same harm with the time that somebody is reviewing them?
Well, that's a complex question, and if the matter is brought to the board and the board feels that this patient is an imminent danger to the public, we will go and get an ISO, interim suspension order, and have that physician cease practicing immediately.
Okay. But if there is someone that could cause potential imminent harm to the public that they are servicing and nobody files a review, then that physician, whomever it may be, female or male, could then conceivably continue to cause harm because somebody didn't want to.
Well, you know, the medical board can only do what it can do when it receives a report. Once we receive the report, the medical board is very efficient at reviewing the case and protecting the public.
Thank you.
But we don't control the institutions or the health plans or the health groups and so forth. You know, that's in a different system. And as I mentioned earlier in my presentation, we feel that that's in the purview of JCHO, the Hospital Association, the Medical Association, and the Department of Health Services. It's not really in the purview of the medical board. Our charge is to protect the public through licensure.
Now, do you feel then that that there should be more little aggressive reinforcements then from those entities that you just spoke of before it even affects you?
Absolutely.
Okay. And then, by the same token, do health plans sometimes contact you because they get complaints from the people that they cover, that perhaps a patient would have not gone through a hospital but would have gone through a plan because they were unhappy or felt that they had been ill-served by a physician or harmful by a physician?
Yeah, I can't comment on that myself. I don't have knowledge in that area. Maybe we can ask our Deputy Executive Officer, Kimberly Kirschmeyer.
Okay.